Welcome to Wonder Hair Career Institute Online. My name is Livina and I'll be your instructor today. Today we are going to talk about passive range of motion. Passive range of motion, elbow, wrist, shoulder, hip, knee, and ankle. We're going to talk about passive range of motion of these at once. What is passive range of motion? Passive range of motion can be defined as what is achieved when an outside force, such as a therapist or a CNA, causes movement of a joint. Active range of motion is what can be achieved when opposing muscles contract and relax, resulting in what? Joint movement. So we have passive range of motion and active range of motion. When you are helping a resident, moving the resident arm, hip, any part of the body, you are the one doing it for the patient. It is passive range of motion. If you are telling your patient, Miss Jones, raise your arm up, raise your hip up, raise your ankle, move it this way, move it that way, and Miss Jones is doing it, this is active range of motion. Again, we're going to start, like I said, we're going to talk about the whole thing together. We look at passive range of motion exercise to one elbow and wrist. Then we'll start on number 3, which is just common to all of them. It's a exercise only correct joints and only correct side when performing range of motion. Remember your care plan. If the question, the card on that day says do range of motion, passive range of motion on the right elbow and wrist, right hip, right ankle, that is care plan. You want to make sure you go to the right side of the body to do this range of motion. If the card said right elbow, right wrist, and you do on the left, you will fail this skill. Support extremity to protect the working joint throughout range of motion. Remember why you are doing this range of motion. You want to make sure you support that particular joint while you are doing this. Bend and straighten arm at elbow through range of motion. This is when the one pertaining to elbow and what? Wrist. If it's shoulder, it say move shoulder through range of motion, raising and lowering arm alongside towards the head of bed and back to the mattress. If it's range of motion, hip, knee, and ankle, it says move resident hip and knee through range of motion, flexing knee and hip, raising towards torso and returning back to mattress. Now, ask resident to report discomfort during range of motion. Ask if resident has discomfort during range of motion exercise. Whatever part of the body you are doing the range of motion, you want to ask your patient, are you having any pain? If you experience pain, let me know. Then you complete the range of motion exercise. Remember those range of motion, you complete at least 3 cycles of those range of motions. It's so easy. Now, some people ask, do I have to mention flexion, hyperextension, hyperflexion? I think my answer is you don't have to if you don't know the word to use. If you're asked to do range of motion on shoulder, do you want to tell the patient, I want to do range of motion, flexion, extension, hyperextension, all those stuff? The patient you are talking to might not be able to understand all those words. You want to talk to the resident in the language they will understand. Some of them might not even understand what is called range of motion. Why not say, Miss Jones, I'm here to perform exercise on your left shoulder. exercise on your left hip. Now give the person direction on what you want him or her to do. I get a lot of those questions. Do I have to say extension, inflation? My answer is, if you don't know it, we are talking to a layman. Your patient don't know all those things, so you can tell them this is what you want to do and tell them what you want them to do during the exercise. Now let's take a few questions. How much assistance does a resident receiving passive range of motion need from the nurse aide? I said it when I was explaining what passive range of motion and active range of motion means. Partial assistance with range of motion exercise, full assistance with the nurse aide taking the joints through exercise, or minimal assistance. Remember, passive range of motion, you are the one moving the patient's body. So it is full assistance you are giving to the patient. Full assistance with the nurse aide taking the joint through exercise. That is what passive range of motion is. Another question. A resident has returned from the hospital after a hip replacement. The nurse aide should expect that the resident will be hip replacement. Is the resident going to be dependent and need total care? Is the patient going to be confined to bed for several weeks? Is the patient going to receive range of motion exercise to that hip? Or is the patient going to have physical therapy to increase mobility? The answer is the patient is going to receive physical therapy to increase what? Mobility. Remember, this person has what? Hip surgery. You want to do range of motion to that hip, a nurse aide, you better be careful. What is the important basic procedure for the nursing assistant to perform to increase muscle strength and joint mobility of a resident who is unable to voluntarily move his or her limb? Resistance exercise, aerobic exercise, active range of motion exercise, or passive range of motion? Passive range of motion exercise. What device is used to prevent contracture? Hand roll, cane, back support, S bandage. The answer is what? Hand roll. Remember, when somebody is contracted, the hands are going like this. When you put that hand roll, it's like you're doing exercise. It prevents that hand from getting contracted. Thank you for watching. I hope you enjoyed the little tips. If you do, please subscribe and hit the notification button. Thank you and good luck in your exams.